Dr. Suvarchala, Scientific Director with Ziva Fertility Centers. How does a fertility specialist evaluate the uterus to examine what's wrong and what's not helping you become pregnant? Let's try to understand these questions. Well, the first test that your doctor will perform is a vaginal ultrasound. It's a very good test which understands if there are any polyps or fibroids or anatomical defects inside your uterus such as septal walls. All these cause infertility or recurrent pregnancy loss. So vaginal ultrasound is a very good investigation to find out what's wrong with your uterus. Then there is the saline infusion sonogram, where a saline solution, which is sterile of course, is passed into your uterus, which then spills on the other side of the tubes. This is a very good way of assessing what is the shape of your uterus, what is the size, if your tubes are open or blocked, and it gives us a very accurate reading. Then comes the Histrosilpinogram. Sometimes we are not able to understand minute details, therefore your doctor may refer you to do a HSG, Histrosilpinogram, where a special dye is passed into your uterus and an X-ray is performed to see if there are any defects present inside your uterus. Let's now look at hysteroscopy. Hysteroscopy is a very simple test where a camera-like telescope is passed into your uterus and we can assess if there is anything wrong with the uterus, as in if there are septal deviations, if there is a unicornate uterus or a bicornate uterus, any anatomical defect if it is present, that can be assessed. If there are damages caused by endometriosis, or if there are scars which have been left behind from previous surgery, if there are polyps or adenomyosis or fibroids present, all can be assessed by a hysteroscopy. Now, a hysteroscopy can be operative or diagnostic. A diagnostic hysteroscopy just tries to assess what's happening inside your uterus, but an operative hysteroscopy is the type which can resolve a problem if it is present. So it's very simple to convert a diagnostic hysteroscopy into an operative one to resolve any issue which might be present. So what can your doctor treat with a hysteroscopy performance? They can take care of endometrial polyps, they can look at uterine fibroids and remove them, they can see if scar tissues are there and also resolve that problem, as I said before, and also, as I said, if there are septums, that can also be cut and the uterus can be structured back into a normal size and shape. There are very few risks of hysteroscopy, and therefore if you have been prescribed or advised to go through a hysteroscopy, do not hesitate. It's a very simple procedure and a lot of information can be gained about your uterus which can help you get pregnant. If you have been diagnosed with hysteroscopy, if you are undergoing infertility and wish to understand more about hysteroscopy, please feel free to understand us. Thank you. A lot of effort has gone into making this video. Please like and subscribe us. Thank you.